This is Jax, and these are Jax Medicare Hacks. Go to it, boy. Right now, between October 15th and December 7th, you need to know some of these Medicare hacks. Number one, first and foremost, the RMDs, if you're over age 73, add to your taxable income. That adds to your IRMAA penalties. It's one of the number one reasons people do what? Roth IRA conversions. You can convert some of your IRAs to Roths, and then guess what? It's all tax exempt income and it doesn't add to your IRMAA penalties. Number two, if you're a young person and you just get on Medicare, think about using those first 5 years in a zero payment plan to pocket money for other late life costs. You can save as much as my wife and I did, about $12,000 a year in premiums. You do that for 5 years and you pocketed $60,000 that you're not paying for Medicare supplements and Part D plans and all that because you're young enough and you're healthy enough. And then you can change later on in your life, and maybe you can pay for a plan that costs a bit more money and has a bit better benefits. But by that time, you saved up so much money, you're way ahead of any MOOP or maximum out of pocket. The third Medicare hack is when you're traveling, go with a plan that's got great international benefits. I'm a big advocate of buying travel insurance, especially med, air, evacuation coverage, but there's no great substitute for having international coverage on your Medicare plan during your heavy travel years. Remember, you can change without any medical evidence between October 15th and December 5th every year, the annual enrollment period, until they change those rules. You can make that change and go from a plan maybe that you pay zero premiums, that doesn't have such great coverage, to a plan where you pay some premiums and you have super good coverage. Another great Medicare hack is if you're looking at big surgeries and if you're looking at hips and knees, and if you're one of those people who really needs to get this stuff done, then of course, when you have the opportunity in your first year after Part B to get on a Medicare supplement plan with no evidence of insurability, no medical questions, by all means, jump on that. Get your hips and knees done. We know a client who did both hips, both knees, and then she got off of the expensive Medicare supplement plan and went to a Medicare Advantage plan that had an out of pocket, but it was insignificant to her because her big work was already done. Right, Jax? My dog Jax and I want you to pay attention to Medicare hacks because paying attention to Medicare hacks is just part of the art of being smart.